So give me an update.
No changes. We did not clean out the garage. That's going to be a tomorrow job or a Sunday job.
Oh, okay.
So, otherwise, normal caseload, normal schedule.
Okay, how's your symptoms been?
My back has been pretty good.
Okay.
It's right now, I'm feeling it in my hamstring. I was on the floor for an hour from 11:30 to 12:30, and that one is always my hardest.
Okay.
I always find myself in that with those kiddos. They're young. They're 2 and 3. They're sibling sets. I'm always shifting and moving them, which then I'm shifting and moving myself.
Do you normally feel symptoms during that or after?
During.
And then what position do you have to get into for relief?
I don't get relief
when
I'm on the floor at all.
Okay.
No.
Even if you bend the leg up or...
And if I do, like I find that if I do like a this, or that I'm doing this, or I'm doing this.
Yes.
Or I'm trying to do this, but like even now, like that's just super tight.
Tight? And is it like achy during that or...
It's more just...
Tight?
Discomfort.
Okay.
Like it's really uncomfortable.
And just in this region?
And then like my last client, I was in a chair.
Okay.
My 10:30, I was in a chair. So today was a pretty good day for not having to be on the floor too much.
Okay. So your back's been holding up, but your leg is a little bit sticky today. And then home program wise, how many times a day are you able to do the nerve glides?
Should I be doing them?
Over the last week, how many times?
None.
Okay. All right. Yeah. So let's just check your range.
Okay.
And let's see where you're at. So go ahead and kick out and stop when you feel stuff. Okay. So like 45 was our benchmark before, right? Were you starting to feel stuff? And today you are at 10, 20, 30, 40, 50. Okay. So it's not bad. Definitely not the worst I've seen it. But I think it's worth giving that nerve some nourishment and blood flow.
Yes.
And then we'll see how you're doing. Were you muscle sore after last time?
The next day, Saturday, I remember getting out of the car from lunch, and I was like, dang, those squats got me.
Oh, okay.
Right here. And of course, Cass was like, what?
Yeah.
I didn't see you doing squats.
And then was your back okay the next day?
It was.
Okay.
Yes.
So last time we upped the nerve glides, we went to a bigger range of motion. And we upped your strengthening of your lower back and legs as well. And it seems like that worked out really well.
Yes.
Okay, so let's continue with that type of stuff, huh? Are you bending it because you're having some symptoms?
Yeah.
Okay, so when you straighten it, you feel it a little bit?
I did.
And then it's off?
I wouldn't say it's off, not like when you make it go off.
Okay, all right.
It's less.
All right, let's get after it. Any symptoms right now then?
No.
Okay. Doing good? Just want to loosen it up the hips a little bit just so I don't have any restriction from them. Good. Oop. I'm going to come down here actually. Any symptoms when I do that?
No, it turns off.
Okay, I'm going to come up.
Right there.
Right there, okay. So this is where I'm hanging out today, a little bit lower than last time. So I'm still going to focus on getting that ankle and toe maxed out here, that stiff little toe of yours. Yeah, for unknown reasons.
Yes.
Doing okay? Feeling it a little bit?
It feels good.
Okay. Yeah, I do want to flirt with it a little bit. I always, I think at this point we've learned with your type of nerve stuff, you can give it quite a bit.
Yes.
And so I'm very excited for that. So I'm going to give it the gamut here. I got a week's worth of catching up to do.
Right.
I'm just kidding. I'm not. Did you get some of the strengthening done or nothing done?
Nothing.
Okay. Life happens.
Yes.
Doing okay? I'm not feeling any restrictions, so that's nice.
Okay.
You feeling symptoms?
Sore.
In the hamstring?
Yes.
Okay.
But not.
Yeah. So I'll do the little bit of a glide there. So right now I'm just kind of gliding and tensioning that nerve, and then I'll do a little bit different here in a second.
I'm starting to feel it into my calf.
Okay, yeah, that's fine. Yep. Yeah, that's the pathway of the nerve. Not your tip. You don't normally feel it in your calf, right? And you only feel it. Yeah. Okay. That's a normal response.
Okay.
It's feeling good.
Now I kick myself for not doing it because it does feel good.
That's all right. So I'm gonna, since the nerve exits your butt muscles, right? Yes. I'm gonna give your butt muscles a little bit of a stretch here too. Does that feel okay? Do you feel?
It feels okay. I mean, I just feel like pulling.
Yeah.
But it doesn't hurt.
No, it shouldn't hurt. Yeah. So I'm just stretching that glute med and piriformis area.
That feels different than that.
I know, right?
Yeah. That little movement.
Yep, that little bit more external rotation and just rotation of the hip will get different muscles. And for you, I want to hit all of them, so I'm just getting all of them. A lot of rain today.
Yeah, it's no fun leaving in the rain and dark. Came in this morning at like 7:45. I'm like, it's so dark in here.
You're here early.
Yeah.
Good stretch there.
Oh yeah.
Hang out here for a moment. It's like one of those hurt so good, right?
It does, yeah.
You're like, okay, is my leg supposed to bend like that?
Can I duplicate that?
You can a little bit. Yeah, we're gonna be definitely going over that home.
All the way to my butt.
Yeah, that's where the muscles are. That big sciatic nerve exits like right in the middle of your butt. So that's why you can have some irritation when you sit.
Is that why people, is that the nerve where people ride with like tennis balls on their lower back when they're driving?
In their lower back?
Yeah.
So some people think that like piriformis syndrome,
okay.
right? And so piriformis syndrome, it technically is like when that muscle is so inflamed or angry or hypertrophied that it impinges on the sciatic nerve. Because about 10% of the population have the nerve that actually goes through the muscle instead of around it. And so it's just based off anatomy or how long you spend sitting, but it's really like you have to have referral down the leg to have sciatic. It's okay. To have sciatic nerve involvement.
Gotcha.
I don't know if that answered your question.
I just have heard people like, just use the tennis ball.
Oh yeah, yeah. That mechanical pressure can feel good, okay, but it sometimes doesn't fix the problem.
Right.
Okay, we're gonna go up higher range. We're gonna do a little different technique. You feel anything right now? Good. How about now?
No.
Good. There.
In my calf.
Okay, I'm gonna give it a little pump here. Feel all right? Hamstring or calf?
Calf.
Woohoo! That's good.
Yeah, hamstring feels fine.
Awesome. It's cool to see a little pop. Cool to see like the tolerance of the nerve to improve as well.
Yeah.
So that tells me that we could be ready for moving over a little bit, which we haven't done yet.
Tells me I should have done this 4 years ago.
Your words, not mine. I do hear that often though. I think this is just a missed part though. A lot of people just don't know. But when I had my herniation in my back, this was it. Like I think my back mobility was good. Like I had good range of motion in my spine, but I was still having like the intermittent symptoms in my hamstring and my leg. And it just wasn't. If you don't address the entire pathway of the nerve, you're missing something. I feel okay?
Yep.
All right, so we're gonna upgrade it here. So what I felt on that side, I'm assuming I'm gonna feel pretty similar. Yeah, it feels pretty similar to me. Like that little bounce at the end is very normal. So what we're going to do is I'm gonna bring you over a little bit. So the more we bring the leg over, the more it tensions the nerve.
Yes.
Okay?
Yes.
And then there's less.
Yes.
Here's more. Do you feel that in your hamstring?
I do.
Yeah, okay. So I don't go nearly as high, but I can pull you over a little sooner. So let me know if you feel it.
Right there.
Right there? So this hits the other branch of the nerve. So the sciatic nerve branches at the back of your knee and it goes into two different nerves. So this is hitting that other branch where you can feel.
Yes.
Okay, yeah. So it's that good lateral / outside of your leg stretch. Feel it?
Yeah, feel a lot right calf.
Okay, that's very normal.
Okay.
It should be like on off though. Like,
Exactly.
okay.
It truly is.
Yeah. And I would say it's really good for your nerves to get used to this, because this is the exact same thing as like bending over.
Okay.
So just hang with me here. And it will loosen up. Doing all right?
Uh-huh.
What would you rate it there?
Down to like from my calf down, it's like an 8.
Okay, 8 out of 10. Okay, but not in your hand.
Okay.
Good. And sometimes you have to get like kind of past that little bit of calf stiffness or uncomfortableness to get to the hamstring once we get in higher ranges. But you can feel the difference between here and here.
Yes.
Right? And so it's so cool. So cool. Give it a little slack there, a little break. So when you do this on your own, that strap is going to come to your shoulder now, or basically to your face.
Okay.
Right? That's what you've been doing.
Yes.
And then you're going to bring it over here, and I'll show
Over my shoulder this way?
Yes. Yeah.
Yeah.
Yep.
Okay.
Exactly. So I'll show you how to do that as well.
Okay.
Last round here, and then we're going to retest.
Okay.
I can feel it.
Often it's like it's twinge.
Yeah. I can feel it. It just changes. Like what I feel when a muscle stretch is way different than a nerve stretch, but it just takes a while to be able to feel that difference. I can just tell like right up to it, it's like right there.
Yes.
Yeah. We'll love. Straighten the leg now. Do you have any symptoms? No. Gone. Okay.
Yes.
Very good. All right. So sit up on the edge. Let's recheck that range of motion. Wherever I put my little measuring device. Oh, I put it back. Yeah, I did. All right.
Oh, wow. Oh.
Feel good?
Yeah.
Good. It's way better. Like 40 degrees.
That's like,
almost there.
yeah. I don't think we've gotten that far. It's a little tremor when I get up.
A little fatigue.
Yes.
Yeah, a little weakness into the quad, which is good. But you didn't feel limited from the
I
hamstring.
didn't get
the nerve thing. Okay.
That woo feeling.
Okay.
All right.
So let's go into, I'm going to show you how to do it on your own. So remember that strap is towards the end of your foot.
Yes.
Little reminder, it's been a week, right?
Yes. Plus, that very first time you showed me, like, if it's on the arch of my foot, it changes things completely.
It's a game changer. Yeah, it's a game changer between on the ball of your foot versus the arch. Yep. Feel it? Okay. Do you feel that in your calf, your hamstring?
Hamstring.
Hamstring. So that I like that pulsing there. Do you have any symptoms at all?
More of like a stretch,
Okay.
not a pain.
Okay, and then there you move into your pain stuff?
Yes.
Okay, so that's perfect to pulse into that. Okay, so you'll do your, 30 reps or so, right? And then you're gonna come down, you're gonna have that leg straight, and then you're gonna switch that strap. Use the loop there for you, so it's a little easier on your arm. Yeah, just like that. And then you'll come over, and you may feel it already.
Yeah.
And then you're gonna do that same pulsing at that area that
Okay.
you have to find it. I can't feel it. You have to find it. But the moral of the story is that foot needs to be what we call midline. So in the middle of your body, not on the outside of your body.
And I'm pulling it this way, though.
Yeah, kind of towards your armpit.
Yes.
Okay. That's kind of the ranges there. Yep.
Okay.
That's it.
Yeah.
Right. So that's upping the ante on the nerve glides.
Okay. So am I still going to do 30 here and then 30 here?
Yeah.
Okay.
Yeah. Yep.
Okay.
The good news is like you'll get so accustomed to doing it. It's
Yeah.
good. Are you doing both sides on your own?
No.
No,
I'm
you're
only
just doing
the
the
one side.
Yeah, you don't have to, right? It's completely your call. You're not having symptoms there, so that's good. Okay, now I want you to stand up, and I want to do the forward bend and see how that feels. Good. Come up. How's that feeling?
No pulling.
No pulling at all?
No.
Okay, well then I guess I have to have you test your sitting position on the floor, right?
Okay.
How you sit with a kiddo and see how that feels.
All right. So I start. Oh, I feel pretty good right now. And then when I get discomfort, I'll do like this.
Okay, so you started with more of a cross leg.
I do. Like
And then-
total crisscross.
Okay, and then once
here.
it starts bothering you, you switch positions.
And then I'll either do like a this.
Okay.
Or I'll do it this. Like, so I feel it right there.
Yes. Okay.
Typically that's the two, or I'll do like this.
Okay.
And see if I can get, but I'm still.
Yeah. Okay.
We were talking about last time.
Yep.
Over everything.
Okay. Good. Well, the good news is it's responding just as how I would expect, in that you're able to notice improvement quicker when you do it.
Yes.
When you do the nerve glides or do complete the nerve glides, you have an improvement in pain intensity, and when I measure it, range of motion as well.
Yes.
Which is good, which means we're on the right track.
I just need to do it.
Consistency is key, right? So you've got to give enough dosage to make change. And while in this session I could do it in a few minutes, you just need that commitment until your symptoms resolve, and then you just don't need them anymore.
Okay.
Okay, so let's go over, let me teach you how to stretch that glute where that nerve exits as well. So go ahead and lay on your back, because you can hit it yourself. That's one you could do on your own.
Okay.
And so this leg can be bent or straight, and then this leg you're going to pull up and use your right hand to stretch your left glute, and you're going to pull over.
Yes, I will do this sometimes. I didn't realize I was doing that.
Yes, yep. And you can give it a good hard yank until you feel it. As long as you don't have any groin pain and it's all in your glute, that's fine. Now, you know that there was a difference when I moved your leg like this as well, right? When I go the more external rotation. So you can use that other leg, bend it up, and give yourself a little bit more of a pull.
Okay.
So
I feel the pull more.
Great, yeah. So if you bend this one up, get this ankle really fixed, and then pull, it can give you that little extra TLC in there. Your choice, whatever feels better for you and your body. I wouldn't say I have one preference over another.
Okay.
But and like I did,
and is that just a pull and a hold?
Pulse, right?
Pulse
yeah, that same good hard yank and then relax. Hard yank and relax. Yeah. And this one, if you do have tight glutes, like you could do this on both sides.
Yes.
I think it's good to stretch out those glutes a little bit.
Yeah, no, that's good.
Was your core sore last time? No? Okay, so we did the dead bug exercise last time to do some core strengthening. That's right. So we're going to continue with the core and leg strengthening as well. Okay? And so that would be your home program plus a little bit more. So you're doing the squats. Are you doing the bridging?
Yes, the bridging, and then I'm doing, we added the dead bug, and we added the on my knees, and I don't know what that one was called, where I go, the cat-cow.
Cat-cow, yep.
And then cat-cow pull back, that one.
Yep, so the mobility and the strengthening. And so I do like that, like mobility first, then strengthen. So let's go on your hands and knees. Let's do like 20 reps. I don't know. Let's do like 20 reps of the cat-cow. Okay. You'll get that full range of motion just to loosen up the lumbar spine. You shouldn't have any symptoms with this. Since your back has been feeling well, I'm not worried at all. This good mobility just gets a lot of those smaller joints moving in your back, and some nutrition. And by nutrition, it's just fluid, right? You get that good fluid into the joint. Wonderful. You have really good motor control, which means the motion's really smooth, and you do well telling your brain to move this area of your back, which is nice. So are you done treating clients today? You got more? I am done today. Oh, there you go.
I have to go get Molly from school.
Okay. You look awesome doing this. Is this comfortable for you?
It is.
Yeah. I know it's a little bit of a weird exercise, the cat-cow or cat-camel, whatever you call it, but it is good at getting some motion into that lumbar spine. Okay, that looks good. And then let's, the other mobility exercise was the child's pose, kind of go in the child's pose, right? Yeah, encouraging just some lumbar flexion. Yep. Very good. That's good with that. And then let's go on your back then. We're going to do a set of the bridges. We're going to up the bridges. We're going to up the ante. Okay. So let's do one set of 20 on the bridges. Do you still get a good muscle burn with this? I do. Okay. So think about squeezing your glutes and lifting your hips. You look great. Very good. You have a nice little tilt first, and then you lift. It looks perfect. Good. On a scale from 1 to 10, how hard is this?
I mean, it's not hard.
Not hard? You feel like you could do 50?
Would I want to? No. Could I? Yes.
Okay. So that tells us that we're kind of ready to up it a little bit, and that you could do it. It's comfortable.
Yes.
You know, we want to continue building that resiliency, so we have to push the envelope a little bit. So let's upgrade this. So we're going to straighten this leg. And what you're going to do is this leg can stay straight, and you're going to lift your hips up, and you want to focus is that your hips don't drop. It doesn't do this. You want to lift them up in unison. Yep. And this.
So am I putting pressure into my heel?
Yep. And drive through your heel, and in your left butt cheek should be firing on a high level.
Yeah.
Yep.
Yeah.
Okay, come back down. All right. Good. So this is a upgraded version for core and back and hip strengthening.
Okay.
Okay. So we're building that resiliency in your lower back and what we call the posterior chain, and just increasing that ability of your body to do more.
Okay.
Right. It's awesome. It's a hard exercise.
Can I put pressure into this heel on my right, or should I not be putting any?
When you're first starting off and doing it, right? If it helps you out a little bit, that's okay, because we're shooting for that 10 to 12 range.
Okay.
And so if you are lacking the strength to do that, and you want some help on this leg, that's okay.
Okay.
Yeah, that's okay. Drive with that heel. It is a hard exercise.
Yes.
Right? I do this with my athletes as well.
Yeah.
It's been shown to have a really good activation of your hip, which is really good.
So should I do it on this side for this hip?
Yeah. Oh yeah. Oh yeah.
I wonder what that's going to look like.
It's a great exercise. Okay, switch it up. So bring this one.
I feel like I have no.
There you go. Try that.
I mean, that's weird.
It is weird. Yeah.
Woo.
Big difference side to side.
Gosh, I can't get it up.
And when we do the one-legged exercises, we can really tell when we're compensating, right? When you do the normal bridge, you didn't get that activation.
No.
You didn't feel it like that.
Yeah, I feel like I have like no coordination. Like I'm really having to.
Why is that, do you think?
Well, because I jacked up that head.
Yeah, okay.
I mean, I think I've babied it for 4 years now.
Yeah, maybe. Yep.
And unintentionally,
Sure.
obviously.
Sure.
Whew.
Just do what you can. Are you starting to cramp here? Does it feel
Not
like?
cramp. I
Okay.
just feel like I have no coordination. Like
Yeah.
I'm telling my body what to do, and it's not doing it.
That's motor control, right?
Right.
That pathway is just a little blurry.
And it's super like shaky. Like
I could see it, yeah. Very
it
shaky.
doesn't feel right at. Oh,
Okay, we'll do one more.
that's scary.
Okay, relax. Good.
Okay.
Whew, so we could tell that we're still working into some of those areas, but once you get really good at doing these one-legged exercises, that's when things really start to change. Because most things in our life are one-legged, right? Most of walking is one-legged, or when
Well,
you...
I've been questioning, because it's been mentioned, that maybe I've compensated so much for the right side that's what's caused the hamstring to cause. And I don't know if that's an answer or not, if we would ever get that answer.
Yeah.
But that was a little freaky to
See the difference?
how much weaker that side is. Okay.
Yeah. Chicken or egg, we don't know, but we know how to treat it, which is good.
Yes.
Okay, go ahead and stand up. Let's see how you feel. And then you're just going to feel pretty good?
Yeah.
Awesome. Then let's do one set of 20 of the squats.
Okay.
Oh, there's a block. Good. So let's spread the feet just a little bit more. And you want to think about having the weight of your body in your heels.
Okay.
And then just sit down and come back up, like into the toilet. There. Ooh, so much better.
Far enough.
Yeah, so much better. So now you're getting good activation of your lower back, your hips, your quads, right? That's going to make you have a little bit of that muscle soreness, which is well earned. Wonderful.
Grinding.
Oh, don't worry about that. Don't worry about that. Good. You're doing awesome. You're enjoying that burn, that good hard work. Right? All of the strength that we're searching for has to be earned. There's nothing that can give it to us. Good. Good. Your form is so much better. Like those pathways of your nervous system are improving. Good. One more. All right, shake it out a little bit. And then that was between the bridge and that. Those were our two strengthening exercises, right? Okay.
Oh, and the bug.
Oh, the core strengthening. Yep,
Yes.
yep. Yeah, very, very much worth it for the dead bug. Okay, we're going to up it.
Okay.
One more here.
Okay.
Sound good?
Sure.
Okay, we're going to use the table to help us,
Okay.
but we're still going to focus on that unilateral strength, right? The bridge is very similar to the squat, and both legs can help you out. You're going to take a big step, way bigger than you would think.
Okay.
And then it's just dropping the back knee as far as you feel comfortable. But you want to stay tall with your body.
Okay.
Right? This is a lunge, and it works on length and strength at the same time. So you should feel a stretch as well as some muscle work. So big step. Now, oh, this was with a toe thing.
Oh.
So this should be fine,
Okay.
right? Because it's your left toe.
Yeah.
So this should be fine. So drop that back knee a little bit towards the ground. Yep. Bigger stride than you think. Right there. And now drop and come back up.
I can't drop.
That's
Ooh,
okay.
It's locking.
What's locking?
My knee.
Back one?
Uh-huh.
Yeah, that's a tight quad.
Okay.
And so that's okay. Stay tall and come back up. But you should feel the stretch in the back leg and work in this leg.
It's so uncoordinated.
I know, I'm sorry. I'm sorry, but you can think of like when you do stuff during the day that requires one leg to work differently than another,
Yes.
you're going to have that same coordination deficit. So yeah, this looks really good. You're doing really good. I can tell this leg's working. All of that muscle is firing. I'm trying to give you the things that are most efficient, right?
Yes.
How can we work the most at once?
Will it be different if I had shoes on? Am I sliding?
Yeah, you are sliding a little
Plus,
bit. It would be different with shoes on. Yeah,
it's not going to make a huge difference, I wouldn't think.
it makes some difference in the range of motion of your feet. That's required too, especially with that left toe. I'm gonna be very
Yes.
curious there because there's a lot of range of motion in your toe that happens with this.
Yes.
We're gonna do what we can though.
Okay.
All right, switch it up. So I don't want you to work into any pain. So with that left foot behind you, yep. Yeah, that's okay.
I feel so much more coordinated on this side. I feel just almost drunk when it's on the right side.
When that stretch is on the right side. You look good, right? Just like when we learned the squat the first time, it was a little awkward.
Yes.
Do you feel some muscle working?
I do.
Okay, good.
I feel several muscles working.
That's why we always start next to the countertop or the table.
Yes.
We don't want to work on the balance at first, but eventually,
Another restriction there because of that toe, like you said.
yeah, it makes that ankle come up
Yeah.
pretty quick. But eventually you can get into deeper ranges and it's much more coordinated.
Sure.
Much more coordinated. And you could do it. You can absolutely do it.
Okay.
So how are you feeling right now?
I'm good.
You should notice your body's been a little worked.
Yes.
But the highlights being that we can go further into the range with the nerve glides and you're able to improve even faster, which makes me even more hopeful of not only your improvement, but your prognosis. Like
Yes.
long term, that should be well managed. And then now we're improving the resiliency of your system. And I'm glad that the back pain is kind of held off a little bit
Yes.
because we're able to accelerate things even more.
Yes.
So it's just really cool.
Okay.
Okay,
All right.
so we're gonna go over the, make sure you're crystal clear on the nerve stuff, the nerve glides, and then keep moving forward,
Okay.
all right?